No,
Um,
I haven't started. I am now starting ice right now.
okay. Hi, how are you?
I'm doing well.
I'm Nurse Khan.
Nice to meet you.
Okay. So, I heard you're in here for a physical exam. Is that the case?
That's correct.
Okay. So I'm gonna go ahead and start. Is that okay?
That's fine.
Okay. So I'm gonna check your skin first. Okay. So I'm looking at your skin. Your color is pink. Okay, and your skin is uniform throughout. Okay, which is good. Okay, so I'm just inspecting your skin. There's no rashes on you, no lesions, nothing.
Nope.
Okay, so that's perfect. So I'm gonna have to touch you. Okay.
That's fine.
Okay, so I'm gonna check right here, a little pinch, and there's no tinting. Your skin turgor is good. Okay, so now we're gonna look at your hair. Is that okay?
That's fine.
Okay, so I see that your hair is in a, yeah.
All
Okay.
good.
Okay, so, all right, so I'm just gonna touch your hair just to check to see if you have any bald spots or anything, and you don't have any hair loss or bald spots or anything like that. So that's good, okay? All right, so that's really good. So, so there's no lumps and bumps, no indentations, tenderness that I could see, okay? Or any, it's soft. There's no nits or lice or infestations on there, okay?
Correct.
Okay. Okay, so, now what I'm going to do is I'm going to check um, your eyebrows, your eyelids, your nasolabial folds, your mouth, to see if it's symmetrical. So your eyebrows, your eyes, your nose, okay, is symmetrical. Your lips, okay, everything is symmetrical. Okay, so, okay, now we're gonna look at your temporal arteries. I'm gonna palpate. Palpating meaning I'm gonna touch you and then I'm gonna auscultate, okay, with my stethoscope, okay?
Fair enough.
Okay. All right, so, this is your temporal arteries here. Okay, I'm palpating. There's no lumps, okay? I could feel a pulse there. So I'm gonna go ahead on and listen with my stethoscope. Okay, just wanna make sure it's on. Okay. Okay, and then I'm gonna do the other side if that's okay. Okay, good job. Okay, and I don't hear any bruise or thrills at all there on auscultation. So, okay, so now I'm going to palpate your sinuses, okay, and your maxillary and the side of your nose. So, okay, so first I want to touch your forehead, your cortex, then your sinuses for any tenderness. Okay. Okay. And there's no tenderness here. Is there any pain at all?
None.
None? Okay, good. All right, so let's look at your nails. I want to check to see if they're smooth, there's no separation, no pitting, no discoloration or clubbing, and capillary refill is less than 2 seconds. Okay, and so I'm gonna check to see about that. Okay, so it's the color is pink on your fingers, skin is warm, intact. Let me check your capillary refill. I'm gonna have to press. So 1, 2, less than 2 seconds. There's no clubbing on either side. Okay. All right. So that's good. So there's no discoloration on there. So next thing I'm gonna do is check your trigeminal nerve. Okay, so your trigeminal nerve is in your cheeks, and it's the muscle of mastication. So go ahead on and open your mouth. Okay, do like you're chewing a little bit first. Okay, then, okay, now open your mouth and then clench down. Okay, all right, so I'm gonna have to get a cotton ball here. Okay, you have any paper towel?
Mhm.
Okay, so go ahead and close your eyes. Okay, and okay, so okay, all right. So I'm gonna touch you with the cotton ball and tell me which side you feel it on. Okay.
My left side.
Okay, I'm gonna do the other side.
My right side.
Okay, perfect. All right, so that's good. All right, so okay, so we did that. Okay, we did the cotton ball, and that's trigeminal, and that's intact. Okay, now we're gonna do your facial nerve, cranial nerve 7. Okay, so what I need you to do is raise your eyebrows, frown, then smile, then show teeth while you smile. Then purse your lips and then close your eyes tight. Okay? Okay, so let's try it. Frown, close your eyes tight. Okay, purse your lips, puff out, do it like this. Okay, all right. Okay, so cranial nerve 5 is intact, okay, because he could do all those. I mean, cranial nerve 7 is intact because he could do all those. You made me laugh, those slides. Okay, all right, so now I'm gonna do his TMJ, okay, his temporomandibular joint. So I'm gonna check on that. Okay, so your TMJ is like, you know, that joint. Okay, so when I tell you to okay, and he can move it pretty well. So go ahead and clench down on it a little bit. Okay, so I didn't hear any clicks there, so I could move on. Okay. Okay. So now what we're gonna do next is the neck and the neck veins. Okay, so for that you're gonna need to lie down on the. Oh yeah. Sorry. Okay. All right, so make sure you can see what I'm doing.
I moved.
Okay. All right, so I'm gonna use this because the light in here isn't too great. So, all right, so I'm checking the right side and there's no jugular vein distension. Okay. Okay, there's no JVD. Okay, I don't see any jugular vein distension. Okay, so we're good there. The neck veins look okay. I'm gonna palpate the neck. Okay, so to see if there's anything on there. Okay, now I need you to sit up. Okay, I just wanna palpate the neck a little bit more. Okay. All right, so I'm gonna have to get behind you because I can only do this from the back kind of thing. So, all right, so I'm gonna palpate your carotid, okay? Not your carotid, your thyroid, to check to see if there's any lumps or nodules, okay? And I don't see anything. Go ahead and swallow. You have any difficulty swallowing there?
None.
Okay, so you're good there. Turn around. Okay, so, all right, so I did your thyroid. Okay, so now I'm gonna do your occipital, your lymph nodes. So your occipital, your postauricular, your preauricular, your carotid, your tonsillar, your submandibular, your submental, cervical chain, and post-cervical, supraclavicular, and epitrochlear. So that's pretty much, okay. All right, so your occipital lymph nodes, and it's not swollen or tender. So, all right, so your your post-auricular. Okay, I don't feel anything. It's not tender. I don't feel any inflammation. Your preauricular lymph nodes. Okay, your submandibular, your parotids, your submental, okay, which is right here. There's no enlargement or inflammation. Your cervical chain and your epitrochlear, I don't feel any lumps or bumps or any tenderness on there, okay? Those are intact, okay? Now we're gonna do the accessory nerve, which is to turn your head from side to side, okay? So you're gonna turn your head from side to side and shrug your shoulders. Okay, shrug your okay, good. Okay, so that's intact. So, all right, we can move on. Okay, so now what we're gonna do is your eyes, okay? I'm gonna inspect your eyes for alignment and symmetry, okay? And your lacrimal lids, okay? So I'm looking at your eyes and they're symmetrical on this side, it's symmetrical to that side, okay? And your, I'm gonna have to touch you for this. Your lacrimal area, eyelashes look good. I just wanna check your lacrimal duct, no tenderness. Okay, your periorbital area, that looks good. Okay, so, okay, so your lacrimal glands are intact. So so now I'm gonna do your optic nerve with the Rosenbaum pocket chart. Okay, so you need to be standing 6 feet from the chart and 2 feet from each eye. So, okay, so that's the chart over there, and it's the eye chart that you would see at the doctor when you go to at the doctor. So stand right here.
That's more than 6 feet, but
all right, so right here is fine. Okay, so so you're gonna go ahead and read the numbers, on the chart. Okay, so tell me which line you can read, and then what numbers or letters are on there.
D, B, C, 4, 3.
What line number is that?
The last line. D,
Okay, so that's 12.
D, B, C, E, D.
Okay, that's
A,
right.
B, C.
Correct. Correct. Okay, have a seat.
Man, this is easy.
Mm?
Nothing. Continue.
Okay. All right. So so now we're gonna do the optic nerve. Okay, which is your peripheral vision. Okay, your arms lengthway in front of you. Okay, and then then patient needs to look at the nose, 4 quadrants, presence, 1 to 3 fingers. Okay, yeah. All right, so, okay, hands straight out in front of you. Okay, look straight ahead. Okay, all right, so I don't have my ophthalmoscope, but okay, so all right, so now I'm gonna check. Go ahead and put this on for a second. Okay, look straight ahead. Okay, so we did. Okay, all right, so now I'm going to check okay, we did the optic nerve when you read the numbers. Okay. Okay, so arms in front of you. Okay. Okay, now try to look at your nose. Okay, can you see it?
Barely.
Okay. All right, barely. Okay, good response. Okay. 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 All right, put your hand down. That's fine. Then, corneal light reflex, eyes. Okay, so I'm gonna check your cornea. So can we turn this light off? Oh, I'll get it.
No, the green. The green.
Okay, alright. Alright, so, okay, so look straight ahead. Okay, I'm gonna check now, okay? Probably should turn this one off.
I'll do that. Turn the other one off too, because I think that might also affect it.
Huh?
Will that
This is
affect
enough,
it?
this is fine. Okay, so, alright, so I'm gonna check your reflexes in this side. Look straight ahead, look at me. Okay, so, alright, it did constrict, and it did constrict on this side. So now I'm gonna check to see for consensual. So keep looking straight ahead. I'm gonna check this side, I'm gonna look at the other side to see if they constricts. Okay, and it did. So that's consensual on that side, now I'm gonna do the other side. Okay? Okay, that's good. Okay, that did constrict. Okay, now I'm gonna check for consensual, and that's good. Alright, it did constrict on the other side when I checked on this side. So now, what I want you to do is follow the light, and I'm gonna bring it to your nose. Okay, and I'm checking for pupils, round, equal, and reactive to light, and accommodation. And your eyes converged, okay, which is good. So, you have your eyes accommodated. Alright, so I'm gonna turn the light back on right quick. Alright, can you see good?
No, that's fine. Yeah.
Okay. Alright, so, alrighty. Okay, so now let's do, okay. Okay, so let's do the cover test. Okay. Okay, so you're gonna stare straight ahead at an object, the TV in front, and I'll cover one eye and keep staring in that direction. And then what we're gonna do is I'm gonna check for any deviation. So let's go ahead on and, okay, so okay, so when you can see my fingers, tell me when and tell me how many numbers I'm holding up, okay?
Should I be recording the numbers that you're holding up?
Okay.
3.
Okay. Okay, so, alright, so go ahead and cover the other eye. Okay. Alright, let's try.
2.
Okay.
3.
Okay, good. Okay, that's good. Alright, now we're gonna do, the 6 cardinal fields of gaze. Now you're gonna be looking at the pen light, and you're gonna follow the tip of the pen light, okay? So, all right, so we're gonna do this. All right, so what we're checking for is to see your ocular muscles, if they move. So let's go ahead and try. 6 cardinal fields of gaze. Follow this.
There's no light on.
Okay. Thank you. Okay, and what I'm checking for to see if there's any extra movements or rolling of the eyes for nystagmus and lid lag, and none of that is present. Okay, so that's good. All right, so let's keep it moving. I did the pupils when the lights were out, consensual and accommodation. So now what I'm gonna do is, I don't have an ophthalmoscope, but we're gonna check your red reflex at a 15-degree angle and move and observe the optic disc, okay? And I wanna check on that, okay? So Okay, so
I'm ready.
Tim. Okay, so, all right, so I'm gonna check you here. Okay, on this eye, okay, I could see that the optic disc, the optic disc is nice and creamy and yellowy, the margins, and okay, so, it's very vascular. Okay, and then I'm gonna check the other side, okay? Okay, red reflex is there on this side. I can see the optic disc. It's nice and creamy and pink. Your conjunctiva is pink. Your sclera is white. Okay, I don't know if I said okay. Red reflex, optic disc, creamy, margins are yellow, sclera pink and conjunctiva. Sclera white and conjunctiva pink. Okay, alrighty. Tim,
Yeah.
wake up. Okay,
I'm
so,
still recording. I'm still good.
okay. All right, so ears. Okay. So let's look. I'm going to inspect your ears and palpate for any discharge. Okay. And then I'm going to look in the ear. And what I want to look at is I want to look at your tympanic membrane to see if it's how it looks. So okay, so let me look in your ears. Okay, so let's do this side first. Okay. Okay, so I'm looking at your ears with my otoscope. Okay, you have a little bit of wax in there. And I can see your tympanic membrane. Okay, let me see. It's translucent, it's concave at 5 o'clock. I see your eardrums and your malleus. Okay, let's look at the other side. Okay. Okay. Okay, I don't see any problems here with the ear. Let's see on the outside. Now I'm gonna look inside. No, there's a little bit of wax. I can see a tympanic membrane. It's no perforation. It's nice and grayish. Okay. Okay, so, all right, so I'm gonna do your acoustic nerve, which is, I'm gonna check your whisper test, and I'm gonna do that by occluding one ear and then whisper, something and see if you can catch it, okay? And then we're gonna change ears, okay? Okay?
Mm-hmm.
Okay, I need to be behind you. Okay, you have the ears occluded?
One.
Okay. Okay. Okay, do the other ear. Okay, remove this side. Okay. Cat eat trap.
Cat eat trap.
Okay, all right, good. Sit down, you're good. All right, so now we're gonna do the line test, okay? And to check your mastoid bone, hearing tone in front of the ear, and to check for conduction. And so we're gonna check that, okay? And then we're going to do the Weber test. So, all right,
Not the
so
Weber test. Please, not the Weber test. I'm kidding. Continue.
Too much stuff has been on the ground.
okay, are you okay?
Go,
All right,
go,
I
go,
really did
fuck you.
lose my spot. So, okay, the Ryan test, okay. All right, so what we're gonna do is I've got my tuning fork, okay? I'm gonna activate it, okay? All right, okay, so I'm gonna actually put it right here. Can you hear it?
Yeah, I can hear everything.
Okay, let's do it again on the other
I'm
side.
imagining, right?
Right. Mm-hmm.
Yeah.
Okay.
Sounds great.
Okay, so and now we're gonna do it again. Okay. Not the Weber test. Is it equal on both sides?
It's a little bit on the right side, but
Okay.
close to the center.
Okay. Alrighty.
Well, your left, my right.
Okay, goody. Alright, so now I'm gonna inspect and palpate the nose. I'm gonna occlude one side of the nose and then switch and inspect the light. I'm gonna put it in the back of your, put it in your nose to see if there's any deviation or blockages, okay? So when I occlude one side, try to breathe.
Right.
Okay. I'm gonna occlude the other side. Okay, now I'm gonna look in there to see if there's any deviations of the nasal septum or blockages. Okay. All right, there was no deviation or blockages noted. Okay. So now the next thing we're gonna do is, okay. Okay, so next thing I'm gonna do is, open your mouth. I'm gonna look in your mouth. All the way, say ah. Ah. Okay.
Not so good.
Okay, good dentition. The tongue is moist and pink. Buccal cavity is pink. Stick your tongue out. Look up. Okay. Okay. Open your mouth all the way. Say ah. Okay. Wow. Your frenulum, I see that. No exudate. The soft palate, the hard palate. Okay. All right. Okay, your tonsils look good. Open your mouth. Okay.
Sorry, I was laughing too hard.
Okay. Oh, tonsils are no exudate. It looks like grade 1 back there. Tonsils. Okay. All right, you can close your mouth. That was just too much fun for you. Okay, so now
It was not fun at all.
that's intact. So glossopharyngeal nerve, I'm gonna check. Okay. All right. So, okay. Now I'm gonna check your vagus nerve. So you're gonna open your mouth and you say again, and I'm gonna access the vulva to see if it elevates. Okay. Open your mouth. Oh, and it did elevate. Okay, that's enough. Okay. All right. So now we're gonna move on. All right. So I'm gonna inspect your chest, okay? For normal rise and fall, and it is normally rising and fall, okay? It's symmetrical on both sides from what I inspect and see, okay? So, I'm gonna check your AP diameter, which should be a 2-to-1 ratio, okay? So, let me see. Okay, just lift up your arms here. Okay. 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 Okay, so, all right, that looks good. It was a 2-to-1 ratio. Okay, so that was all inspection. So now I'm gonna palpate with my fingers to see if there's any lesions or tenderness, okay? And I'm gonna check
I hope
for
this is the prostate.
tactile fremitus posteriorly for any vibrations, okay? Okay, so, all right, so I'm gonna palpate, okay? All right, for anything, so say 99, Say where's 99?
99.
Okay. All right. Let me see. Turn around a little bit. So let me just check. Say 99.
99.
99.
99.
Okay, and there's no tactile fremitus. Okay, so turn around again. You're good. Okay. So now I'm going to check your lung sounds, okay? Okay, we're gonna do it anteriorly.
Ave
Okay.
Maria.
Okay, so, good. Breathe in and out. Okay, I'm listening for any bronchial sounds anteriorly, okay, and vesicular sounds. And his lungs are clear bilaterally, okay, and I'm gonna just listen here and here. Then I'm gonna do the back. Okay. All right, so you could get up because it's probably better for you this way. Okay, so, no, wait, I need to see, so she can see the camera. Okay, so, all right, so I'm doing this from right to left. Take a deep breath. I'm listening for bronchial sounds. Okay. Good job. Under your arms here a little bit. In and out. Okay. So I need you to say 99 again while I listen, okay?
99. Say what?
Say 99.
99.
99.
99. 99.
99. Now that's actually audible. Okay, so now I need you to say the vowel E.
E.
Okay? I'm gonna check for Egoffi.
E-I-O-U-I.
Just say E.
E. E. E. E.
Okay. All right. So now I'm gonna whisper something to you. Okay? And I need you to say it, and I'll listen to you. You said it?
I just whispered too.
I'm sorry.
Huh?
1, 2, 3.
Yeah, but you didn't whisper it.
I
You
did.
didn't
I
whisper
did.
it. Okay. All right, let's try it again.
I'm
Okay,
super.
I'm gonna say another word then.
I don't know what you said, but I said Captain Right, something like that.
Oh, I heard that. Okay, I'm gonna say it on this side. Okay, I heard that. Okay, so, all right, so I just, go ahead and, okay, so I just listened to, that. So now what I'm gonna do, did Egoffi, bronchophy, and, whisper polytrophy. And what I was doing is checking to see if you had any pneumonia or consolidation in your lungs. Okay? So now I'm going to percuss your lungs. Okay?
That sounds painful.
No, it's not painful.
I'm scared. Come on, let's go.
Okay. Okay, let's do this side. And what I'm doing is I'm listening for tympanic sounds. Okay, let's do the back. I don't know. Can you, so she could see it?
Yeah, I got it.
Okay, and okay, so now I'm going to go ahead and just check back here. Any pain, tenderness, anything? Okay, so tympanic sounds are present there. So now I'm gonna do the diaphragmatic excursion, which what I'm gonna do is posterior exhale. Okay, hold it. And I'm gonna percuss down your right side for dullness, okay? And then you're gonna inhale and hold it.
I'm holding an exhale.
And then I'm gonna percuss down the other side. Okay? Okay, so, okay, let's do this side first. Okay. Okay, so inhale. Okay. All right, this looks like, okay, let's do the other side. Okay, this looks like a 2 to 5 ratio on here. So that's a normal finding. Okay, now we're gonna do your heart circulation, okay? So I'm gonna inspect the pericardium. Okay, I think you might need to just take this off for a second, if that's okay.
What do you mean? No. Do it for the gram.
Okay, so.
Take
all right.
it off.
Okay. Okay, quit clowning. Okay. Darn, I can't even. Okay, so inspect the pericardium and I'm gonna inspect it. Then I'm gonna
Inspect the pectorals,
palpate
too.
it for any
Same.
thrills or pulsations. So I'm inspecting it. Okay,
Told
and
you.
there's nothing, you know, it's clear. And I'm gonna palpate it. Okay, and no pulsations are here. Okay, so that's a good sign. Okay, so so there's 5 areas to this assessment, and the first area we're gonna look at is the aortic, and that's for I'm looking for the closure of the closure of the semilunar valves. Okay, and the second is the second right intercostal space. Okay, which is the dub. Then we're gonna do the pulmonic closure, which is the semilunar valve, and that's the second left intercostal space, which is the dub, S2. And then we're gonna do Erb's point, okay? And that will be the left third intercostal space. And then the tricuspid closure, which is on the fourth space, and then the fourth intercostal space, and that's going to be part of the lub. And the mitral area, which is closure of the AV valve, and the fifth left intercostal midclavicular, and that's a part of the lub. And I'm going to be checking for murmurs, any swooshes, and defects, any valve narrowing, and regurgitation. Okay?
Let's do it.
All right, so let's do it. All right, so, okay, so I'm here at the sternum, second intercostal space. Okay, this is the aortic area. Okay, and I'm listening, and the valves are closing, the semilunar valve. Then I'm gonna do the left sternobord, the second intercostal space, okay? And this is the pulmonic, and that's closure of the semilunar valves. And then I'm going to listen to the third intercostal space, which is Erb's point, okay? Okay, no heaves, no thrills. I'm gonna listen to see if you have any bruits. Nothing. Then, okay. Then mid-axillary, and this is your mitral area. Okay, okay, so I do have to, you have to lie down for this section here. Tim, Tim, wake up.
Good luck with that.
Okay.
Okay. Okay, so, okay.
I'm lying down the correct way, right? Not on my front.
Yeah. So I'm gonna listen for murmurs, any type of, detecting any murmurs, systolic murmurs, ventricle contraction, and diastolic murmurs. Okay? Okay, so this is mid-clavicular, and this is the tricuspid area. I'm gonna listen with my bell. Deep breath. Deep breath. Okay. Then mid-axillary. This is the mitral area. Deep breath. And I don't hear any bruise or trills or splitting sounds. Okay, and there's no murmurs, systolic or diastolic murmurs that I could hear. Okay. So the splitting sounds, if in S3 I would have, let's see if we could listen to see if the Kentucky would indicate any fluid overload, and S4 would be before S1, and it would be, I would be listening for, have you say Tennessee, an atrial kick, okay, and any resistance on that, okay? Hello?
Sounds good to me.
Okay. Okay. Kentucky. Okay, none of that is present. Okay, you can sit up. Okay, Tim, wake up.
You know what you're saying?
Nothing. I wasn't saying anything. Okay, so the carotid arteries. So I'm gonna do your carotid arteries. Okay. So I'm gonna check those. Okay, I'm gonna do that one at a time. Okay, and those are present. And then I'm gonna auscultate over them. Okay, and I don't hear any thrills or bruise on there. Okay. Okay. Okay, so now we're gonna check all your pulses, okay? So we're gonna do your radial pulse, okay, together.
All together now.
Okay, Tim, wake up. Radial pulse, okay? And they're equal, 2 plus. Then we're gonna do your brachial pulse. Okay, and those are equal, 2 plus. Okay, and then what we're gonna do is we're gonna do your, okay, I need to do your popliteal pulses. Okay, let's do your femorals. Okay, those are present. Okay, we'll do back here the popliteals. Okay. Okay, and then we're gonna do your oh, you got boots on. Take those off. Don't take too long.
What else do you want me to take off?
Sorry. Wasn't trying to get you naked over here, but okay.
Well, here we are.
Mm.
What are you missing from the first time you did this?
Okay, so now what we're gonna do is I'm gonna check your posterior tibialis, and those are present, and then your dorsalis pedis, and those are also present. Okay, that's perfect. Okay, so all right, so now we're gonna do your abdominal assessment. Is he holding it up?
Not very well.
Why
Okay.
don't you go to sleep? I'm just tired.
I corrected it.
Okay. So I want you to lie supine under a pillow, on the pillow, okay? Lie on your back.
You just sing Rockabye Baby?
No, not rockabye, baby. Let me get that. Okay. Okay.
Oh my god, I need to
Alright,
go to
so-
the bathroom and pee.
Okay, well, I'm almost here at the abdomen, so let's just knock it out. Okay, alright, so you're supine. I'm gonna inspect first, okay? And I don't see any, I see some hair on your abdomen. I don't see any lesions or anything. I see you, the work of breathing. It's okay, your abdomen. Okay, so I'm looking for, peristalsis here. Then I'm going to listen to your quadrants for your peristalsis. So let's start on the right lower quadrant. Okay. Okay, once I hear 5, I can move on. Okay, and then I do up here. Okay, perfect. And this is normal active bowel sounds, and this is in all 4 quads. Okay. Okay, good job. Okay, so now we're gonna do, so now I'm gonna percuss the liver to make sure that, okay, so I'm gonna start at the right mid-clavicular intercostal, the upper border, at the 5th to 7th, 5 to 7 centimeters. So, okay, so now I'm gonna just put my hand here, okay? Okay, this is, I'm percussing the hepatic area. Okay, all right, and all I hear is tympanic sounds here. Okay, now I'm gonna do the splenic area, for any, okay, so, and for any splenomegaly, okay? This is on this side here. Okay, I'm just checking here for dullness. Okay, and that's present. Okay. All right, so, okay, so now I'm gonna lightly palpate your 4 quadrants, okay? And I'm gonna listen for any, pulsations or triple A's or anything like that, and there's no pulsations in there.
You're still young, you need to get an autopressor for that.
Huh? Hold that camera up. Okay, so, all right, so, I quit talking. Okay, so there's no pulsations there. Okay, now I'm going to do what we call deep palpation over all 4 quadrants. So we're gonna do the liver and the costal margins, and we're gonna do the spleen, which I already percussed the spleen. Okay?
You take care of this
Okay, so
liver. I have to go
here's
to
the
restroom. I
liver.
need to pee.
Stop talking to him. Okay. Okay, I don't feel any masses. Okay. Okay. No masses, and I'm just gonna deeply palpate here too. Okay, liver, the spleen is not enlarged. Okay, no masses were felt. Okay. Okay, so now we're gonna do CVA tenderness, which is the posterior hand flat on your back below the rib. Okay, and use fist to tap for tenderness. Okay, and that's gonna check for any kidney infections. Okay. Any tenderness? Okay, all right. All right. Okay. All right, so now, all right, get up. We're gonna inspect your musculoskeletal system, inspect your joints for any redness, crepitus, or swelling, okay? Inspecting for joints for any redness, crepitus, or swelling, none is noted. Now we're gonna do your neck. So flex your neck, okay? Okay, extend it from ear to shoulder.
From ear to shoulder, like.
Right, and then the other side. Okay? Turn side to side. Okay, those are intact. Now we're gonna do your shoulder, okay? We're gonna do adduction. Adduction is toward the body, okay? So what you're gonna do is reach down across your body, okay? Okay? And then do it with the other side. Okay? Now we're gonna abduct, okay? And abduct, so we're gonna arms out, side to side, over the head. Okay, good job. Now we're gonna do internal rotation of the hand behind the back, okay? The thumb, okay, and the hand behind the back on both sides. Now we're gonna do external rotation, which is the palms, okay, up and the forearms bent, okay? And a 90-degree rotation outward on both sides. Now we're gonna do elbows, okay? Flexion, we're gonna bend toward the body, okay? Then we're gonna do extension and we're gonna straighten them out toward the thighs, okay? Both sides. Now we're gonna do supination, which is turning the palms up on both sides. And then pronation, which is turning them down. So now we're gonna bend the wrists up and down, okay? Now we're going to do the fingers, okay? So we're going to, we're gonna make a fist. We're gonna open and spread the fingers, okay? Okay, good job. So now we're gonna do the hips, okay? You're gonna be supine, okay? And then you're gonna bend your lips up. When I say supine, you need to lie down. And then you're gonna bend your hips up and rotate your knees toward your body. Okay, that's it. Okay, and away from your body. So you're gonna bring it out. Okay, and do the other side. Okay, now you're gonna extend your leg. Okay.
Hyperextend.
Yeah. Yeah, hyperextend.
I don't know what you mean by hyperextend, but.
Well, you're doing it. Okay, so okay. All right, so you're going to. Okay, so you did your rotation of the hip. So you're going to raise your leg and knee and extend them with the knees bent. Then you're going to hyperextend the leg behind and adduct, bring it close to the body, cross over and over the other leg. Okay, that's it. Then you're going to abduct and extend the leg out again. Then do the other side. Okay, good job. Then you're gonna bend your knee, and then you're gonna straighten your leg. Okay, all right. Okay, then we're gonna do your foot and the soles of your foot together. Okay, and outward. Okay. Okay, and then what we're gonna do is your vertebral column. So you're gonna have to get up and touch your toes. Okay, touch your toes. Okay, and then you're gonna bend backward and turn at your waist. From each side to side, right side, left side. And then you're gonna bend. Okay, all right. Okay, you're able to go through those with good range of motion on all of those. Okay.
Great range of motions.
Great. Okay, good. Thanks for the correction. And then the strength. Okay, we're gonna check your strength, and we're gonna do your neck. Okay. So go ahead and sit down. So this is how we're gonna do your neck. Okay. So I'm gonna put my hand right here by your cheek, okay? And you, oh my God. Tim, stop. Okay, you're gonna try to turn, and I'm gonna try to resist you on this side. Okay.
Good luck.
Okay, then let's do the other side. Okay, all right. So, then we're gonna do your shoulders, your hands and your shoulders, and you're gonna shrug against resistance. Okay? Okay, shrug. Okay, oh my God. You're strong. Okay, so then now we're gonna do your elbow. Hand on your forehead, hand on your forearm, on your forearm.
My forearm or forehead?
Your forearm. And push, and then I'm going to pull and then push it, okay? So
I think that your hand on my forearm.
yeah, I think so. So okay, so I'm gonna put your now try to resist me. So I'm gonna try to push you down.
I can't do it.
Oh, don't you even? Okay, then okay. Okay, you're too strong for me. Okay, all right. So I'm gonna squeeze your fingers now. Okay, squeeze. I said squeeze. Don't try to kill me. Just squeeze my fingers. Okay, you have pretty good squeeze. Okay, that's strong and equal. It's a 5+ on both sides. Okay, so now we have to do your hips now again. So what we're gonna do is you're gonna lay down. Okay?
Again?
Yeah, I'm sorry. Yeah. Okay. Okay, so bend your knees a little bit.
Again?
Yeah, so bend both of them.
Oh my God.
Okay, so I'm gonna try to. Okay, so I'm gonna try to.
No.
Okay, push against me. Okay, now let's do the other side. Okay, that's good. Okay, yeah, I'm just checking your strength. And then, okay, wait a second. Okay, knees, hand on the back of the calf and pull. Okay, so I'm gonna do that for you. Hand on the back of the calf and pull. So try to resist me.
I can't do it.
I said try. I didn't say do it like so hard. Oh my God, you're killing me. Okay, now we're gonna do your ankles. Okay, pushing your toes down against resistance. Okay, so
all my finger leaves move. They are good.
Okay, so I'm gonna push your toes down. Try to resist me. Okay, you're a 5 on that too. I'm gonna try to push against me this way. Okay. Oh my God, you're strong. 5.
Linda,
Okay.
how long more is this gonna be?
Okay, now.
That's what I'm saying.
Let's do we're almost done. Your deep tendon reflexes. Okay, so. All right,
Deep tendon reflexes.
Yeah, okay, so. All right, so. So I'm going to put my thumb on your AC right here. I don't have my hammer, but this is going to be like my hammer. Okay, let's see. On the AC, which is right here. Okay. Oh, and he did twitch on both sides, okay? So now what I'm gonna do is I'm gonna do your triceps, okay? And I'm gonna check your triceps and your your brachial radialis first, since we're on this side. And then, okay. So those are all working well, okay? Okay, now we're gonna do your knees. Okay, your knee jerk reflex. Okay, perfect.
Fake, right?
Yeah. And then the Achilles right above your toes. Okay, wait. Okay, yep, that jerked. Yep, that jerked. Okay, now we're gonna do the bottom of your feet. Okay, that's negative for Babinski. Okay, negative for Babinski.
I'm Fabinski.
Babinski.
Babinski.
Usually kids have it, but usually adults don't.
Babushka.
Okay. All right, so sensation with a cotton swab and a pin. Okay, so this is gonna be your cotton swab.
It's getting worse.
This is gonna be your pin. Cotton swab. Close your eyes. Okay, this is gonna be the cotton swab. This is gonna be the pin. Okay. Close your eyes. Tell me what I'm touching you with. We're doing upper extremities.
The swab.
Okay.
The pin. The swab. The pin.
Okay, now we're gonna do lower extremities.
I mean, I have pants on, but it's still a swab.
Okay.
Swab again.
Okay. What is that? This one.
It's the pin.
Okay.
It's the
Okay.
pin.
Okay, just checking you out. Okay, now what I want to do is I'm gonna close your eyes. Okay. I don't have. Does anybody have a coin? No.
Coin?
Yeah. Okay, that's fine. So.
So I'll put the coins upstairs.
That's okay. Alright, so I'm okay. Okay, we don't have a coin. Alright, so this is gonna be your coin. Okay, you feel how that feels?
Yeah, it feels like a key, not a coin.
It's a coin for right now.
Yeah, it's a coin. It's a great coin.
Okay. Alright,
Is
so
that-
open
is
your
that vintage?
hands. Open your hands. Yeah, it's vintage. Open your hands. Okay. So, okay, close your eyes. What is this?
That's a coin key.
Okay. And what's this?
That's not a coin key.
Okay.
It's a
Open
piece
the
of-
other
That's a
hand.
piece of paper.
Oh, Lord. You're supposed to
That's
cooperate.
that's a coin.
You're so,
That's a piece of paper.
oh my God. Okay, now I'm gonna check you with your eyes closed. Okay. Okay. Now I'm gonna write some. Stop acting like a
See,
kid.
that's reflexes.
Okay. All right. So I'm gonna write something in here. Okay. So okay. Tell me what I wrote.
Bitch.
No, don't do that. This is a test, dude. Stop. It's not funny.
She didn't write anything though.
Okay.
You're actually not writing anything.
Okay. I'm writing something.
Think about it.
What is this?
You're writing cursive?
No, I'm right. Okay, let me try something else. Okay, what's this number?
That's a 1.
Okay, good. Let's do it on the other side.
She said,
One.
fuck you.
Okay, huh?
She
What?
said, fuck you.
You're writing a 2, but it was not a good
It's
2.
test.
Got edited.
Okay,
Got
so,
edited.
alright, so let's do this. We're checking cerebellar function. You know when the cop
Oh,
goes
no,
forward?
don't check that. He has no cerebellum.
Okay, now come on. We're gonna do, you know when the cop goes over, you do finger to nose, out and back.
Yeah.
Then you're gonna touch. You're gonna do your nose on both sides, and then you're gonna touch your finger to your nose, and then you're gonna touch me, and then we're gonna do rapid hand patting. Okay? All right. So let's try it. Okay. All right. Let's go. You gotta do it. Okay. Okay. Do the other side.
You should have put this on a tripod.
Yeah.
Okay.
Yeah.
All right. Okay, so now you're gonna do it, and then you're gonna touch my finger. Okay, you ready? Okay, quick. Okay, do the other side. Quick, let's do it again. Okay, Let's do it again. Okay. I think you might be intoxicated here. Okay, so now I'm
No way.
gonna do sternal nudge. Okay, so I'm gonna nudge you. Okay? Let me see how you
Push back.
react. Okay. All right. Okay. Okay. So now we're gonna do the Romberg's test. Okay. All right. So
Stop.
now you're gonna do the Romberg test. You gotta stand up.
Yeah,
Okay.
I'm worried about the Romberg test.
All right,
I was
Romberg.
not find the bullet.
Okay. So you're gonna either put your hands on your side or put your hands like, but you gotta stay still. I'm gonna check your balance. Stay still. Can you stay still for 30 seconds?
I'm not moving.
Okay, perfect. Okay. All right. So, okay, that checks out. Okay, now you're gonna walk normally over here. Look over here.
Walk normally?
Yeah, walk normally. Then you're gonna walk like this. Heel. No. That's not how you walk normally. Then you're gonna do heel, toe. Look at what I'm doing. Heel. Look at what I'm doing. Okay, you're gonna walk normally. Then you're gonna do heel to toe.
That's how I
Then you're
walk.
gonna go up on your toes and walk. Then you're gonna walk on your heels, and then you're gonna turn around and walk back. Not sideways. Now you can go.
The DUI line.
DUI is right. Okay,
He got it.
Definitely gonna
I
get
walk the
caught.
line backwards.
It's not his
You
first
definitely
rodeo.
I walk the line backwards.
Oh my
Yeah.
god.
Line right there, right?
You've
Backwards.
been to the hill.
Hey, moonwalk.
Is that moonwalk?
Bitch.
He tried.
Hey, stop
it.
Okay,
for-
okay, we're done.
It's for the
That's-
children.
Okay, that's it. Okay, you did a wonderful. Thank you, son.
Yeah, you suck, Chris.
Yay. Less curse words.
Great job.
Those sensors.
Great
Okay,
job.
thank
Thank
you.
you for the hell.
Okay, did we